But I want to highlight a positive thing that you just touched on that I think is worth sort of broadcasting, which is people would say that after 2 years, they tied their shoelace, right? After 3 years, they walked a few miles. So that's important. With stroke, one of the amazing things is you can keep getting better even 2 years and 3 years later.
This is the Recovery After Stroke podcast with Bill Gassiamis, helping you navigate recovery after stroke.
Hello and welcome to episode 222 of the Recovery After Stroke podcast. To learn more about my guests, including links to their social media and other pages, and to download a full transcript of the entire interview, please go to recoveryafterstroke.com/episodes. If you would like to support this podcast, the best way to do it is to leave the show a 5-star review and a few words about what the show means to you on iTunes and Spotify. And if you're watching on YouTube, comment below the video. Like this episode, and to get future notifications of new episodes as they become available, hit the notifications bell. Now, sharing the show with family and friends on social media will make it possible for people who may need this type of content to find it easier, and they may make a difference to somebody that is on the road to recovery after their own experience with stroke. Now, as part of World Stroke Day on October 29, my guest today is special guest Dr. J. Mocco, MD, a cerebrovascular and endovascular neurosurgeon with clinical interests in stroke, brain aneurysms, subarachnoid hemorrhage, arteriovenous malformations, cavernous malformations, carotid artery stenosis, intracranial stenosis, and brain tumors. Dr. Mocco has published more than 525 peer-reviewed publications, edited 3 textbooks on neurosurgical techniques, and runs numerous national and international clinical trials to improve the treatment of patients with cerebrovascular disease. Dr. Mocco's research interests focus on translational efforts to treat ischemic and hemorrhagic stroke. Now, this is the kind of person that I'm eternally grateful for. The person who decides that they are going to do all that study, put all that time and effort into helping people with conditions like mine, which ended up in me having 3 hemorrhages, then brain surgery, and all of the recovery that came after that, that's still going nearly 10 years beyond the first incident. So I hope you enjoy this episode. Now it's on with the show. Dr. J. Mocco, welcome to the podcast.
Thank you very much. Very glad to be here.
I hope you like people saying fantastic things about you, because from what I've read in your bio, you're the kind of person who I get really excited to meet, and I'm really thankful that you guys exist. You're going to have to tell me a little bit about yourself, because I want to know, how is it possible that somebody wakes up one day and decides they're going to spend their life, they're going to dedicate their entire life to helping people they haven't even met yet? And I'm one of those people, because somebody did that for me when I experienced a brain hemorrhage as a result of an AVM when I was only 37, and I didn't even know that I needed people like you. How did you get to that point where you started down this path and became a neurosurgeon?
I mean, it depends on how many hours we have to discuss, but I don't think it's the kind of thing that happens in one sort of, cataclysmic moment on the road where a light shines in front of you. It's more of a life leading you. I had, the unfortunate circumstances, experience, some tragedies and some challenges in my early life with family members, and that was very inspiring, and happened to be good at science and math and those sorts of things. And so that sort of made sense. But I'll tell you, when I went to med school, I didn't have any idea I didn't know the difference between a pediatrician and a psychologist and a surgeon. But as you start doing it, you start to realize the kind of life you want, the kind of care you want to provide. So even though I didn't know that I wanted to treat stroke, as I started going through medical school, I knew what I did want to do. I wanted to help people that were in distress, where if I was good at doing what I could do and I could commit my time to make a larger difference, it would be a life and death event and really make a dramatic impact. And there isn't a lot of medicine that's specifically that acute in that way. And so I was drawn to the field. It wasn't so much that I chose it, but that it fit what I was looking for in terms of making a difference in the world. And I think all physicians get into their career to find that way that they feel their best. Well, I hope all physicians to find the place where their personality and their skill set can make the greatest difference. For me, this just happened to be the place where I could do it, and it happens to be a place where time matters, and where getting people to the right expertise matters. And so you can be focused on becoming a good surgeon. That was a big part of my career. But then the next part is focusing on sorry, all of a sudden there's beeps going on. Focus on not just how good are you at doing something, but how do you help the larger community? How do we work on getting patients to the right place every time? As you may know from your experience, getting in the right hands quickly can be absolutely crucial.
Yeah, that's definitely the most important thing as far as the layperson is concerned, because we don't know that we need to know these things until it happens to us, and then we become guided by our instincts, which aren't sometimes telling us that we need to be taking action, because what we're doing is then we're letting our head get in the way, our thinking get in the way, which says, this can't be happening to me, or I'm too young, or I don't need to take any action about this. And I'm one of those people. I ignored the symptoms of a brain hemorrhage for 7 days before I did anything about it. And many people told me to go and get help and see somebody. And I ignored it because I didn't know any better. And I'm glad that once the wheels were in motion and I was in the right place, which was a hospital in Melbourne in Australia, then from there, there was a lot of people that came around me to make things better for me. And thankfully, they took that decision-making part out of my hands, because I was not in any shape, nor did I have the gosh, for lack of a better word, the intelligence that I needed to have around physical health. So if there's such a thing as emotional intelligence, and if there's such a thing as IQ, I didn't have physical intelligence. I didn't understand that my body had dramatically given me feedback by going numb on the entire left side. I didn't understand that it was communicating that you need to go and get some help. So I didn't go for a long, long time.
Well, it's really interesting you say that, because I want to maybe I'll make you feel a little bit better, because first of all, that's normal in general for human beings, right? It's fundamental to our nature that we don't think about bad things happening to us. Otherwise, you'd be walking around afraid all the time. So that's a natural human instinct, right? And everyone's heard about this for heart attacks, right? If you feel chest pain, if you feel pressure, you got to go in, because people will say, "Oh, I'll just sleep it off, or I'll ignore it." So we have that problem with stroke, and brain hemorrhage as a stroke as well. We have that problem with stroke, but then we have and this might make you feel a little bit better, but when you have injury to your brain, it specifically affects your ability to really understand what's going on. I once took care of a stroke doctor, a neurologist who specialized in doing emergency room call and taking care of patients with strokes, who was having a stroke and couldn't move half his body. But because of the stroke, he was not aware that he couldn't move half his body.
Yeah.
So you'd ask him to lift up his arms. He'd lift up just one arm, right? That's one of the things we look for, is arm weakness. And I'd say, "Do you realize that?" And he's like, "No, everything's fine." Because the stroke, your brain is who you are. Your awareness of the world, it is all processed in your brain, a la the Matrix. And so if there's something going on in there, it actually limits your ability to realize. So it wasn't just you being a little stubborn and denying it. Your brain had a little bit to do with that too.
Good. Look, it's a better story to tell people that I was stubborn and denying it. But I do appreciate the fact that I'm having a stroke at the same time, and it's impacting my thinking. It's very common, because almost everybody I interview tells me the same thing. Very few people that I've interviewed about their stroke will say to me, I knew I was having a stroke, I went to the doctors immediately, and I did the best thing. Most people don't get that opportunity.
A reason why I emphasize that is for loved ones and family members. Like you said, people took it out of your control, right? They took it out of your ability to continue to deny. And so I would say that to anyone listening that's a loved one. When, nobody wants to tell their father or mother or brother or sister, stop it, you're going to the hospital right now. But actually, we have to feel empowered to do that in those sorts of circumstances.
I completely agree with you, because a little while after that happened to me, a friend of mine had a mini stroke. Again, she was in her late 30s, and her son, who was about 16 at the time, of course, pays attention to what mum tells him to do or not do. So when his mum said, I'm fine, do not do anything, do not call the ambulance, I'm not going to go, he paid attention to her. He did what she said. His instinct was saying that something was wrong, but of course he listened to his mum. He didn't know what was exactly happening. And at some point, I think I got involved in the conversation because she was nearby my house, this friend of mine. And I said, ignore what she's telling you, just get her the help that she needs. And they end up taking her to the hospital. And it was a mini stroke. She was 37 years old. I mean, it's ridiculous.
Well, you bring up a really important second point there, which is that's the other tool of denial. Is people say, well, I'm young or I'm healthy. That doesn't matter. Stroke strikes everybody. I have treated so many 20 and 30 and 40-year-olds. It is not uncommon. Certainly, as we get older, we suffer more healthcare problems. But it's important for people to realize that just because they're in their 30s, they still could be having a stroke. And unfortunately, I've even had personal friends that have experienced that.
Yeah. It's, what do they say? It's like 1 in 4 people will experience a stroke in their lifetime.
It's shockingly common. And I challenge you to talk to any friend or person you know. Obviously, for your case, it's everyone you know because of yourself. But I tell people, talk to your friends. I would be dumbfounded if your life hasn't been touched by stroke. If you or one of your loved ones or one of your friends haven't been significantly affected, because it is ubiquitous, it's extremely common. And on top of it, there's an additional challenge in that it's the leading cause of long-term disability. So it's not only something that can be devastating, but it's something that can leave people in a very dependent state. When you poll populations about what situation they don't want to experience, where they don't want to be in the future, stroke is the most feared disease because nobody wants to be left dependent.
It is, and it does stay with you for life. It's something that, even though I've had brain surgery to remove the faulty blood vessel, and it's no longer possible for it to bleed, I'm still left with the deficits on my left side, the numbness, the altered sensation, the proprioception issues, the balance issues, all those things that came as a result of the life-saving surgery now are with me forever, and they're never going to go away. And that's the hard part. It's a hard thing to reconcile, especially for people who end up more physically unable than me. For example, people who end up in a wheelchair, or people who end up with hemiplegia. They can attest to the fact that not only does it change your life instantly, it then changes your identity, and then getting that back is often difficult and a hard road. And I just posted on my Instagram, I just posted a question that my followers ask, and one of the questions that I posed was, what is one of the little wins that people have had recently on their journey to stroke recovery? And some of the simple things that they'll tell you is that after 5 years, they were able to tie their shoelaces, or after 3 years, they were able to walk a few miles, or some little things that most of us took for granted and thought insignificant at the time have all of a sudden become really serious and amazing accomplishments for people who have been trying to get back there for months or years, if not decades.
I think that is so true. You know, someone once told me, try to walk around for a day with, not being able to use one arm. You don't realize all the, you think about it for obvious things, but all the little things you do during the day if you're limited in that way. But I want to highlight a positive thing that you just touched on that I think is worth sort of broadcasting, which is people would say that after 2 years, they tied their shoelace, right? After 3 years, they walked a few miles. So that's important. With stroke, one of the amazing things is you can keep getting better even 2 years and 3 years later. And so for any person listening or anyone who's been through that, the recovery potential exists, and it exists for a long time. So obviously the most important thing is to not have it or to avoid it or to fix it quickly enough that there's no injury to the brain. But I always meet with my patients at 3 months, at 6 months, mainly want to make sure they're getting the right therapy and rehab and such, but also to make sure they understand that there's still lots of potential for recovery, even 2 years and 3 years later, to continue to improve. A lot of times, if you injure some part of your body, after a month or two, if it's still the way it is, that's just the way it's going to be. It doesn't really change dramatically over the delayed time period. But your brain has incredible plasticity, and you can still affect improvement over a long period of time. So keeping that positive attitude and keeping the tenacity of working at it and working to improve it will allow someone who can't tie their shoelaces at 6 months to be able to tie their shoelaces at 2 years. And I hope that brings a positive message to people, that they realize the potential's there.
I think it does, because some of your colleagues, and I don't want you to speak on behalf of them or comment on what your colleagues may be doing that's not right or that's a little flawed in their thinking, is some of your colleagues will say to people that that person's never going to walk again. I get people on my podcast who I interview who will tell me often that that's what the doctor said to them when they were in the ward. And it's crazy that someone would say that to a patient who's just in the acute phase of stroke. And I feel like the reason is because they miss that opportunity to understand what you understand, because of the additional work that you've done to have your master's in science, which is the research part of the work that you do. Whereas some other doctors perhaps have gone to that point where they're treating people in hospitals and don't have that additional skill set of understanding research and data and numbers, and then seeing long-term impacts of stroke on people after a certain period of time, not just in the acute phase. So I think that's kind of what they're missing. They're missing that understanding of the long-term view, and perhaps they don't get to see a lot of stroke survivors many years, or the same ones many years after they first came across them, and therefore they don't get the opportunity to go, wow, that person wasn't able to do all those things when I first met them, and now they can do all these things. And I think that they also don't realize that there's power in their words, and it could be for the case of power for evil rather than good. And I know that's not their intention, and maybe they're trying to decrease the expectations so people don't get disappointed, but stuff that, I hear that most stroke survivors would rather have some kind of like hope at the beginning that there'll be an improvement, and then they can work towards getting there, rather than having all hope quashed at the beginning.
Yeah, that's a tough one. I do think that there's a couple things going on there. I think, number one, I think it's really important to realize that there are a lot of doctors out there who are all trying to do their very best. But the reality is also expertise matters. And a lot of times still, stroke is cared for because of force needs and allocation and resources and all the rest, stroke is cared for by people who are not specialists or in places where there aren't specialists.
Wow.
And I do think that causes a real problem because, as you said, there's a selection bias. If you're not a specialist, if you're not someone who really lives and breathes it every day and dives into that, it's hard to know those things. And so, frankly, the fault here is with myself and with my colleagues who are specialists to make sure we get the word out there well enough to the broader medical community. Because you are right, unless you see these patients a year and 2 years and 3 years later, unless you're working with them, it is hard to realize. I'll tell you, one of the things I do is when I see a stroke patient a year later, 2 years later, I've had patients where, there were people in the healthcare team who felt that patient should not receive further care. And then 2 years later, they're essentially normal. They've got things like you said, but no one on the street would know.
Mm.
And what I do is I always ask those patients, and they're almost always willing to or able to. I ask them, would you mind coming with me up to the ICU? Would you mind talking to some of the other ICU doctors and the nurses and letting them see? Because they don't remember. Because when we see a sick stroke patient with a breathing tube and all the wires and the connections, it's hard to see. And now this person comes in and they're coiffed and they're dressed normal and they look great. And they say, oh, I'm Mr. and Mrs. Smith that was in bed 12 for 3 months 2 years ago. And then the lights shine in their eyes and they realize.
Yeah.
And so, I do believe that the vast majority of physicians are in it to help people and do their very best. And so it's a call to arms for the physicians that are specialists who have put that extra time in, gotten those extra degrees to get the word out to our colleagues, along the crew. But on the flip side, I would encourage any listeners, seek out specialists, seek out the people that live and breathe this. Because I do think in the end it matters. You go to I use the saying, you go to a Ford guy to fix your Ford and a Chevy guy to fix your Chevy. Don't go to a generalist. Go to the people that really know what they're doing for that part of your body, that brain.
Couldn't be more important. Look, I did sack a few doctors in my time going through the early stages. And that was exactly because of that. I just didn't feel cared for properly. And I wasn't part of the conversation. And I was part of the, I was the person they were talking about at the end of the bed. And it's kind of like, I need to be involved, guys. You need to let me know what's going on, good, bad, or indifferent. I need to know. And they weren't doing that. So I just packed my bags and we left. We went elsewhere with a referral, etc. We did it properly. And then we sought out exactly the kind of person that I knew was going to talk to me the way that I needed to be spoken to. And she was amazing, an amazing neurosurgeon who's a professor of neurosurgery now at Royal Melbourne Hospital in Melbourne, where I'm from. Dr. Kate Drummond, absolutely amazing lady, and she just told me straight down the line exactly the way that it was, and the confidence that she gave me in her ability and her team's ability to sort out this difficult to get to AVM in the middle of my brain near my cerebellum, about 4 centimeters in from the ear. I felt like handing myself over to her was the smartest and best decision I'd ever made in my life. And it turned out to be exactly that. So that's why I'm eternally grateful for people like you, because it's life altering and life changing. It's giving us a second opportunity. So it's important to, pump your feathers up a little bit every once in a while and let you know. I'm sure people do, but I think it's still important to say that. And I'll tell you why, because how many years does it take to become a doctor, a medical doctor?
I think it depends on the person. Here in the United States, that process was 8 years.
Okay. And then you did your master's in science. How long did that take?
Well, I did a neurosurgeon, which was 7 years. And during that time, I did a master's in science. And then I also did a fellowship to be a true specialist in stroke, which was another 2 years. So when you add that all up, I don't really want to do the math. It'll get me depressed, but I wouldn't trade it for the world. It's an amazing job. It's an
Yeah,
amazing.
I get it, right? So this is the thing people need to appreciate. The people on the other side of the screen listening to this who are stroke survivors, they do appreciate it. I just don't think they realize how much. So in that time, you're hard on yourself because you say, now I've got to come up with the time to tell everybody about all the things they should know. And here you are. It looks like you're in your scrubs. You're in a room in the hospital, I imagine, and you've jumped on Zoom and we're going to do this conversation. We're here because of World Stroke Day on the 29th.
If you've had a stroke and you're in recovery, you'll know what a scary and confusing time it can be. You're likely to have a lot of questions going through your mind. Like, how long will it take to recover? Will I actually recover? What things should I avoid in case I make matters worse? Doctors will explain things, but obviously you've never had a stroke before. You probably don't know what questions to ask. If this is you, you may be missing out on doing things that could help speed up your recovery. If you're finding yourself in that situation, stop worrying and head to recoveryafterstroke.com, where you can download a guide that will help you. It's called 7 Questions to Ask Your Doctor About Your Stroke. These 7 questions are the ones Bill wished he'd asked when he was recovering from a stroke. They'll not only help you better understand your condition, they'll help you take a more active role in your recovery. Head to the website now, recoveryafterstroke.com, and download the guide. It's free.
Of this month. And as a result of that, I couldn't be more excited to have a podcast that I started in 2015. There's 220 or so episodes now. And now I'm having to raise awareness in that space where I felt awareness wasn't available and there wasn't enough space for it. And there wasn't enough for stroke survivors to sort of learn from somewhere where we could learn from each other about stroke. And that's why the podcast was born. It was born so that we can encourage each other and we can find a way to get beyond all of the troubles that we are facing because of stroke, and also to bring experts like you on so that I can offer hope and give people that long-term view and say, hey, I know it's tough now, but it's going to get better. And even though it's really, really tough and it's the hardest thing you've ever done, there's light at the end of the tunnel. So with that, go ahead.
Oh, sorry, go ahead.
No, it's all right.
Well, I was just going to say, I agree. I think that's an incredibly important message, that there's light at the end of the tunnel for those patients that have been through it. But I want to throw out a challenge to your listeners also, because something that you said a second ago really resonated with me, in that you, because of the kind of stroke you had, in one small way, you were fortunate because you had the ability to search out and find the right doctor.
Mm-hmm.
There are kinds of strokes, particularly what's called ischemic stroke. You had what's called a hemorrhagic stroke. Mm. There are kinds of strokes where people don't have that ability, right? They're just brought to a place. They don't have the ability to check and search. And so if there's something that your body of listeners can do and our community more broadly can do, is to engage with our governmental bodies, our emergency medical systems, our legislatures, whatever the way it works in your area, to make sure that those patients that don't have the ability to make a choice, that don't have the time to find out, that our government, that our society has figured out to ensure that those patients get taken to the right places, right? Because that's important. Right now, the biggest predictor of whether someone who has one of those bad strokes is going to have a good outcome or a bad outcome is where they get taken that very first time. Do they get taken to a place that can treat them? Or do they get taken to a random emergency room that says, oh, we can do stroke, but they haven't demonstrated that they have all of the correct tools to take care of it? And so I would put that challenge out there, because something that you said really resonated to me on that, the ability to choose or not choose. And for those that can't, we need to work within our communities to make that happen.
Yeah, I couldn't agree more. Specific stroke hospitals in Melbourne exist. We have, I think, about 4 or 5 of them where if there is some kind of a diagnosis that's made, whether it's over the phone, if you ring Our 000 in Australia is the emergency number. In the United States, it's 911. So if we ring 000 and we say, well, I'm suspecting that this person is having a stroke, they'll send out a stroke ambulance, and then they'll get that person to a stroke hospital. And that's the part that we can do. We can know the signs of stroke, which we'll talk about. And then once we know the signs of stroke, we can specifically say to our emergency services, I think this person is having a stroke, and therefore they will then make the correct decision to get that person, A, the right ambulance, and B, to the right location.
That's right. And you mentioned something else that's really important about calling the 000 or the 911 or the emergency services, because the other thing people say, well, I don't want to take an ambulance, drive me to the hospital, or I'm going to drive myself. And they may even say, well, I can get there faster in my car. But I want everyone to know, well, that may or may not be true, probably isn't, but let's say it even is. What you don't realize is if the ambulance is taking you, they're calling the hospital ahead. So they're getting the hospital ready to receive you. They're getting the CAT scan ready to scan you. And so when you get to the hospital, your process to getting treated for your stroke will be so much faster if you've called 911 or 000 rather than trying to just drive yourself in and show up and say, hey, I think I'm having a stroke. So I just, that's an important, you touched on it, and it's a great point to emphasize.
It's very important, because not only that, the ambulance is also equipped to support you, stabilize you while you are in their care. Yeah. So even if you get there quicker, you're not driving on your own, you're not being stabilized, supported. You can have an accident, you can have a collision, you can injure yourself or somebody else seriously. And we don't want to be doing that. And I say that because I'm about to admit that I drove myself to the hospital the second time I had a brain hemorrhage. And I did exactly the opposite to what you just said. And then when I got there, I did what I got there. I went to emergency and I said, I think I'm having a stroke. You guys need to get me into the CT scanner. And they looked at me and said, what kind of drugs are you on? Exactly. They didn't actually say that, but they were thinking it.
Yeah, you could see it in their eyes.
Yeah, right. And I'm like, guys, there's no time. You need to get me in. You need to get me in. I'm having a stroke. And they're saying to me, give us your details. Tell us who you are. What's happening? You know, we can't just take you in. You got to give us some information. I gave them my name. It was the Royal Melbourne Hospital that I had driven myself to. And then they said, okay, now we have your patient records. And sure enough, they put me in a wheelchair. They gave me the red carpet treatment, and I was straight in, and I was in CT scan. And of course, it revealed that I was having a bleed on the brain. And this time, instead of, there's, you know how normally in a CT room or in a radiography area, there's a couple of people operating the machines and checking that everything's going correctly from the back of the window. This time there was a sea of people in the back of the radiography room. And I'm sure they wanted to see who this crazy guy was who walked in saying that he's having a stroke. So it was the wrong thing to do. But again, it was that decision that I made under duress of a blood clot in my head and a bleeding brain. So,
well, it's better than saying I'm going to go take a nap and sleep it off. So, of all the choices, you did okay. But I would encourage people. It seems like more inconvenience, but it's actually pretty important, because the ambulance would have already provided them that information as they were bringing you in, and that would have made it more efficient.
Yeah, it's the safest. If it's the safest route to hospital, that's for sure. So what else can we do to improve patient outcomes? I know that doctors are doing a lot. So what we can do, we've spoken about actually briefly. We've said that we can not pay attention to stroke survivors or people who we suspect are unwell from a stroke when they tell us they don't want to go to hospital. We said that already. We said that they can call the ambulance. Better off calling an ambulance before they decide to drive. Make sure we improve outcomes for the people that are outside of the car and also for the people that are inside the car. And now we want to get them to hospital as soon as possible, because in the case of an ischemic stroke, there's a lot that can be done to open up the blood flow to that blood vessel again. So tell me a little bit about some of the stuff that happens there.
That's right. Well, in the most common type of stroke, which is the ischemic stroke, a clot, instead of bleeding into the brain, it goes up to the brain and blocks an artery. It's sort of like getting a pipe clogged. And when that happens, blood flow can't get to the brain tissue, and it slowly starts to die. It's sort of like being unable to breathe, being underwater. It's getting starved of oxygen. But we know now, unequivocally, it's been proven definitively in a bunch of very important big randomized trials that came out 7 years ago, a little over, almost 8 years ago now, that showed that if you get in here and you have one of those blockages and it's giving you a significant stroke, and we go up there and we take the clot out that's causing the problem and we restore the blood flow, essentially function like a really fancy plumber, and we take that clot out and restore the flow, that patients do much, much better. And this is important. It's really important to hammer this home, because I think a lot of look, there's a lot of things we do in medicine that are helpful, that are good, but you're playing a numbers game. It's odds, right? To do a lot of regular medical therapies, protective therapies, you have to treat 50 people, 40 people in order to help one person. That's typical. It's okay, right? But you're improving your chances of doing well. And some of the so if you think you're having a heart attack and you go in and they go do an intervention to check out your heart, the numbers around between 1 in 13 and 1 in 16 people that you do that procedure on, that you actually definitively help for sure. Okay. For this kind of stroke, if you're having a major stroke with a blockage, the number of people you need to do the procedure on in order to help someone be independent is 2.
Wow.
Every 2 people you treat, one of them is going to be saved from disability and death that they would have otherwise had. Think about that. I mean, it's literally without question among the most powerful, if not the most powerful treatment we have for sort of any disease that exists. But here's what's a killer. Even though we have this among the most powerful treatments that exist in all of medicine, right now only about 10% of people ever even get a shot at it.
Right.
How devastating is that?
That's terrible.
Something like 85 to 90% of people never even get a shot at the treatment because they take too long. It's not their fault, but it takes too long. The process takes too long. They go to the wrong hospital. They sleep it off. That's the other. By the way, the other reason for an ambulance, the ambulance knows to take you to the right place. You just get in the car and you drive to wherever your local place is. They may or may not have that ability to treat it. Yeah. So for all these reasons, if we think a stroke is happening, time matters, and we got to get you there as quick as possible to treat you. Now, that doesn't mean that you say, "Oh, this has been going on for 10 hours. I guess there's nothing to do." The truth is, we've shown that it's helpful even 24 hours later, which really means it's helpful even 48 or so. We just only studied out 24 so far. The point is, if it's happening, you get there, because as soon as we can provide the help we can. Just last night, 9:30 last night, I treated a young woman, very young actually. Let's see, what was she been, like 38, 39 years old, with one of these kind of strokes. And she had been having the symptoms for 21 hours.
Wow.
Unfortunately, she was actually at a different hospital where it just wasn't recognized or picked up. And then when they did, she came over right away. So these are the challenges. And we've got to get that number from 10% to hopefully 100% or pretty darn close. And that's why we do things like this. And that's, thank goodness for you and people like you that are getting the word out, talking with people, communicating. It's incredibly important that we address these things very, very quickly. About 80% of all strokes are these kinds of stroke, or ischemic strokes.
Yeah.
About half of them are the kind where we can go up and take the blood clot out. So in the United States, that's close to 500,000 people, at least a year, that we could be helping, and we're helping about 50,000. So that's what we gotta improve on that.
Yeah, numbers have to get better. And when you're helping those 50,000, and hopefully it becomes 500,000, hopefully what that means is that's 500,000 people getting back to being productive. That's 500,000 people being part of their community again. That's 500,000 people that are not dependent on social services or services from other areas. That's 500,000 people that have got back to their families and can be supporting them in being a dad, a mum, a brother, a sister, or whatever. That's so many people that can just go back to being the most active member of their community as they possibly can, and their family as they possibly can. And the ripple effects are they're just immeasurable.
The ripple effects are huge. So it's not just 500,000 people that are saved from disability. It's 500,000 caregivers. And in fact, it's usually about 2 caregivers per patient that's disabled, right? So it's 1 million people that are their lives have been changed as well, to have to care for their loved ones or provide support for their community or the person they're affiliated with. So it's a lot. It's a devastating disease, and it is, it's a fight. It's a battle for us to get the word out there, to communicate with people so that they go, people so that they reach out and they engage with their communities and in their civic unit to get legislation or EMS protocols or guidance, departments of health, whatever, to get patients to the hospitals that have the expertise as soon as possible. And that's what we just have to keep working at. We just have to keep putting the time in.
We're going to ask some more of our listeners and people watching on YouTube. What we're going to ask of them this time, I'm going to say to them, if every person who listened to this podcast episode shares it on their Facebook, their social media, wherever they can, if they shared it to the people that love them, just to the people in their community, what that will do is, it'll help them raise awareness about the condition that they're experiencing, that they're going through. And also it'll help raise awareness about prevention, and it'll help create a conversation around how other people who are out there who have not experienced a stroke, how they can become aware of stroke, so that in case one of their relatives, one of their loved ones, one of their work colleagues experiences the symptoms that we're going to talk about now, or the signs of stroke, that perhaps what they can do is know how to respond quicker, and as a result, support that person getting the help that we want them to get as quickly as possible, so that they can be eligible for thrombectomies, so they can be eligible for all the interventions that are going to improve outcomes. So the FAST acronym is used worldwide, and we talk about F standing for face. So what
I'm gonna jump in there. I'm gonna give you a little hot update. We're trying to push B.F.A.S.T.
Okay, let's do it.
B.F.A.S.T. All right, we're gonna shake everything up here.
Okay.
All right, because particularly if it's involving the back part of the brain, like the cerebellum, right? One of the things you can get is balance problems or vision problems, and so we're gonna push to your audience, hopefully, so that they're aware, so they can help their loved ones, so they can tell their loved ones, no, you have a B.F.A.S.T. We're calling 911. We're calling 000. Is B for balance.
Mm-hmm.
So the person has significant balance problems, that can be a sign they're having a stroke. E for blurry eyesight or loss of vision, right? And that's a TIA as well, by the way, for someone who's carotid disease, to lose vision in one eye. Just did a surgery on Sunday morning for a patient who had that problem, right? And then we go to the FAST, right? Face, for part of your face drooping, your face being asymmetric. Arm weakness. If they try to lift up their arms, they can't lift one of their arms. It's hanging down. They may not even recognize that they're having that problem, but it'll be immediately apparent. Or speech difficulty, slurred speech, or a lot of times people will have trouble getting words out or understanding. They'll say words that don't make sense. Salad bag door instead of, I think I'm having a stroke. The connections get messed up. And then we lock it down with time, T for B.F.A.S.T. Time to call emergency services, call 000, call 911. That's our, we're always evolving. That's our new hot mnemonic to get out there.
I have to say, I've seen that a lot in international discussions about stroke, but I haven't seen it much in Australia, B.F.A.S.T. I'm aware of it, but the Stroke Foundation in Australia still does the FAST acronym. So maybe need to look at that at some stage. I'd say they're already discussing that and looking at how they can roll out B.F.A.S.T and change the conversation. But I do like that because my stroke wasn't fast. I didn't have any issues with my face that were visible. I didn't have any arm issues. I didn't have any speech issues. The time thing was out the window. So everything I did wasn't fast. And a lot of people who I do speak to and have asked on my Instagram haven't had a fast stroke. So some of them we do then decrease that number when we do add balance and eyes, because a lot of them have had eye issues, and often some of them fell over because they had balance issues. So I do like that. Now, let's talk about the Get Ahead of Stroke campaign. I know we've touched on a lot of things about how we can improve outcomes for people, how we can get ahead of stroke from the perspective of the conversation between perhaps stroke survivors, in my case, and the community around me, and then all the other stroke survivors listening in the community around them. If we could kind of get them to do that, they will get ahead of stroke in that they will make other people aware of something they weren't aware of before, even if it's just in the back of their mind. So if they recognize something in the future, they might go, I wonder if that's a stroke. I've heard about that somewhere. Tell me what Get Ahead of Stroke is, as far as it sounds like it's a campaign that you guys are running.
That's exactly right. So the Get Ahead of Stroke campaign is something that's primarily organized by the SNIS Society of Neurointerventional Surgery, but also a number of collaborative and associated organizations that are really trying to improve stroke care. And what we often say is systems of care, the way people get to treatment. And that comes by two ways: raising public awareness, getting out there, communicating. Please, to your listeners, like you said, share it on Facebook, share it on Twitter, get the word out there, because the more people are empowered, the more people that know if they have these symptoms, they have to get treated. We're gonna save lives. And then also policy. How can we engage with those who drive policy? Our leaders, our government officials, our communities, even our hospitals as entities, to make them more aware. How do we save more lives? How do we improve the outcomes for stroke patients? That's what Get Ahead of Stroke is. It's been tremendously successful. We've shifted policy broadly across the United States. We've engaged internationally, but the fight's far from over. There's a lot to be done, and a lot of difference to still be made. But even if one person hears this and they respond, I think that's awfully important. And I'll tell you one last thing, just as we're talking about the symptoms, because you're right. I love the real world experiences that you have, right? Hearing from your followers or your population who say, I didn't have those fast symptoms, right? And I think adding balance and eyes helps a lot. But along your lines, I'm going to add one more, which is, if someone has a significant headache, new, sudden onset, something different than they've had before. Okay, there are people that have never had headaches. There are people that have headaches. I get headaches not infrequently. Take a little Tylenol, it's fine. This is different. If you have a different thing, a new severe headache of some sort, you should get that checked out. All right, that's another kind of hemorrhagic stroke from a vascular malformation, a weakness in a blood vessel, an aneurysm, an AVM, something like that. It's certainly worth evaluating. So I'll throw that one in there. B.F.A.S.T plus headache.
Yeah. If I do think about it, the first sign that nobody was able to confirm for me anyway, my first experience where there was definitely something wrong with me when I ignored it at the beginning was in February 2012. In about September of 2010, I had one of those most ridiculous, crazy, unbelievably bad headaches, and it lasted for about 3 days. And I did actually feel that bad that I took myself to hospital, and they did run every test that you can possibly imagine, including a lumbar puncture. They were suspecting a bleed on the brain, but they couldn't find any sign of it. And they didn't run MRI, they only did a CT scan and didn't pick up the arteriovenous malformation in my head. And I believe that that was the first sign of my my brain hemorrhage that was going to come. But of course, when we're talking about that experience, nobody can link it, and it's fair enough, and I don't expect them to link it. But I was so unwell that I couldn't go to see, the team that I loved in the football, in Australian football, in the final game of the season to win the championship. I was that unwell, where those championship games come around once in a lifetime. Maybe if you've got a great team, they might come around 3 or 4 times in a lifetime. So by the time that Saturday afternoon had come up, I was 6 or 7 days beyond the first incidence of that massive headache, that onset, which I couldn't describe, that had never been like that before. And I was still feeling unwell 5 or 6 days later, even though I'd been to the hospital and visited everybody that I could to get to the bottom of it. It settled down. I'm assuming, I've concluded that perhaps the AVM was playing up and it was just kind of causing some issues and letting me know that it was there in some way. And then it settled down and things got better as I rested, because I was at the football the following weekend, again, to cheer my team on to that following game. And I was screaming and yelling and being a crazy person like sports fanatics are. And I think that triggered it to play up. So that's my diagnosis. I don't expect anyone to agree with it. But it was a massive headache. And yes, we can't add that to the B.F.A.S.T message, but we can talk about it as something that people may experience that has often led to a diagnosis of stroke of some kind.
I completely agree. I think it's difficult to balance all those things, but if you're having, one of those symptoms, particularly if it's something that's new, if it's something you've never had before, it's important. It's important to get evaluated. It's important to do it in a timely fashion. It's important to go to a place where there's expertise, and hopefully you come out on the other side okay. I will say your doctor certainly did a great job. You seem really fantastic.
They are. I'm eternally grateful, and I can't. And I think I need to have these conversations with people like you, with all my guests so far, because what I feel like is that I have been given a second lease on life so that I can make a difference in the world, society, I don't know, in the community. And this is a really easy way for me to do it because technology makes it so. And because I'm well enough and have the capacity to, I think that I need to make the most of that ability while I still have it and while I'm young enough to have the energy to do all of that stuff. Because from here, and if I decide that I'm not doing it anymore in a few years' time or multiple years, hopefully somebody else will pick up the baton and they'll run with it and continue these conversations, because there was nothing like this for me 10 years ago. I can't imagine what it was like for people 20 years ago. And since the technology exists, and since there's this ability for us to reach so many people so easily from around the world, I think that we must make use of this technology. We must. It's our duty to make use of this technology and make life better and easier for people coming through stroke, because there's going to be a heck of a lot of them. There's going to be a heck of a lot of them coming through it in the future, and they're going to need resources. And I don't want their caregivers, their loved ones, their family members to be in the position that I was in, and their position that my wife and kids were in, and that my mum and dad were in, and all my extended family in, when they didn't know, Jay, they didn't know what it meant for this guy who at 37 is in hospital and now has an uncertain future. They didn't know.
Yep, that's exactly right. Unfortunately, I see it every day. And our populations are aging. These are going to be increasingly difficult challenges that we have to address. And it's absolutely important we get the word out there. I love the way you said it. You said it with passion. And there is an obligation, right? I mean, on some level, it's my job. On some level, it's your passion, what you've experienced. But I would again throw out there to the whole community that hears this, that's listening. Let's get the word out there. Let's get B.F.A.S.T out there. Let's spread the word about this podcast. Let's spread the word about even just that. Even just, if you have B.F.A.S.T and it's a stroke, be worried it's a stroke, call 911, get into the hospital. I think that even by itself, sometimes the littlest things, you could change a person's life forever.
Yeah.
Save their life, change their and their loved one's life forever by taking a little bit of time to forward this or communicate it and put the word out there. And I'd highly recommend anyone who wants, you can just Google Get Ahead of Stroke or go to getaheadofstroke.org. There's all kinds of little bits of information and news there. You can throw that out there. Send the link. Say, hey, learn about stroke. Take 5 minutes. Check this webpage out. Anything, because all of it adds up, right? It's a grassroots thing, and momentum has to build so that it becomes part of our general knowledge as a society. And I really have tremendous gratitude to you for everything you're doing along these lines. Very appreciative.
My pleasure. On that note, I will ensure that getaheadofstroke.org is added to the show notes. People who want to find the link, get a transcript of this episode can go to recoveryafterstroke.com/episodes, and they'll be able to see that information there. It'll be on the YouTube description as well. Dr. J. Mocco, thank you so much for being on the podcast and taking an hour of your time out of your day to be on the show.
It's been a real pleasure, and fingers crossed we change some lives today.
I think we will.
I think so. Take care.
Thanks for joining us on today's episode. If you're a stroke survivor with a story to share about your experience, come and join me on the show. The interviews are not scripted. You do not have to plan for them. All you need to do to qualify is be a stroke survivor or care for somebody who is a stroke survivor, or you are one of the fabulous people that help other people who have had a stroke. Go to recoveryafterstroke.com/contact, fill out the form, and as soon as I receive your request, I'll respond with more details on how you can choose a time that works for you and me to meet over Zoom. Thanks again for being here and listening. I really appreciate you, and see you on the next episode.
Importantly, we present many podcasts designed to give you an insight and understanding into the experiences of other individuals. Opinions and treatment protocols discussed during any podcast are the individual's own experience, and we do not necessarily share the same opinion, nor do we recommend any treatment protocol discussed. All content on this website and any linked blog, podcast, or video material controlled this website or content is created and produced for informational purposes only and is largely based on the personal experience of Bill Gassiamis. The content is intended to complement your medical treatment and support healing. It is not intended to be a substitute for professional medical advice and should not be relied on as health advice. The information is general and may not be suitable for your personal injuries, circumstances, or health objectives. Do not use our content as a standalone resource to diagnose, treat, cure, or prevent any disease for therapeutic purposes or as a substitute for the advice of a health professional. Never delay seeking advice or disregard the advice of a medical professional, your doctor, or your rehabilitation program based on our content. If you have any questions or concerns about your health or medical condition, please seek guidance from a doctor or other medical professional. If you are experiencing a health emergency or think you might be, call 000 if in Australia, or your local emergency number immediately for emergency assistance, or go to the nearest hospital emergency department. Medical information changes constantly. While we aim to provide current, quality information in our content, we do not provide any guarantees and assume no legal liability or responsibility for the accuracy, currency, or completeness of the content. If you choose to rely on any information within our content, you do so solely at your own risk. We are careful with links we provide. However, third-party links from our website are followed at your own risk, and we are not responsible for any information you find there.